Boroko Shopping Centre in Port Moresby is a hotspot for sex workers and men seeking their services.
The men that we go out with, they're risky and it does become dangerous, especially at night.
I've come here to meet Sylvia, not her real name. She spent more than a decade earning a living through sex work.
A lot of the time we are attacked and sometimes almost killed by these men.
But violence isn't the only risk these women face. PNG is today grappling with a surge in HIV cases.
There are men who are infected and hanging around here too, and some come just to harm and kill as well.
There's almost 200,000 female sex workers in PNG and almost 359,000 male clients.
I don't care if they're giving me a large sum of money for sex. If they refuse to use a condom, I refuse sex as well, because my life is also important and I am doing this to live.
In 2025, PNG declared a national HIV emergency with over 11,000 new infections. There's over 120,000 people living with HIV in the country, although that number is thought to be much higher.
Very good morning, John. How are you?
I'm well.
John West Tory started Indepth Hope in 2003 with some friends, 2 years after he was diagnosed with HIV.
PNG has the highest rate of HIV infections in the Pacific.
His organization provides support and services to people who have contracted the virus, including tracking down positive cases to make sure they receive treatment. But he says despite their efforts, it's an uphill battle.
We know that globally HIV infections have dropped. Not so here.
During the 1990s, HIV cases rose steeply in PNG. By the early 2000s, HIV became the leading cause of death at Port Moresby General Hospital. Increased testing and other public health measures saw cases steady in the 2010s. But in recent years, funding cuts and neglect have accelerated the epidemic. US aid was a major contributor. Those services have been nearly entirely shut down.
When the funding cuts came, then the increase in people living with HIV has gone up tremendously.
Indepth Hope Executive Director Melanie Palili says funding remains the critical barrier to expanding their work.
We have a lot of members who would love to go out and do the awareness activities, but we need money to support with logistics.
Melanie says when they do have enough funds for community outreach, they see huge demand, especially for condoms.
I think we went close to 200,000 condoms that were distributed. And surprisingly, most of those that came to get the condoms were pregnant women or mothers or females. Most of the women were spouses of men that were working remotely, or they know of their spouses having extramarital affairs. Like, those were the assumptions that we had. And I guess out of fear of them contracting HIV, they wanted to ensure they had the condoms on hand just to protect themselves.
Stigma around HIV also remains pervasive.
In the beginning, the stigma and the discrimination around people living were really bad. In the hospitals and the clinics, even the health workers were, they just don't want to, they don't want to see, they don't want to touch people living with HIV.
Someone who understands this more than most is Maura Elaripe. She was the first woman to publicly disclose her HIV status in Papua New Guinea. She's dedicated almost 3 decades to helping people with HIV and says it can be lonely.
I don't really have real friends. Like, I don't know who I call friend. Sorry, excuse me. Yeah, so most of my friends have died, people whom I am so close to.
Diagnosed in 1997 while pregnant with her first child, she later lost her second child and husband.
So my 2 babies' grave. My
first baby was 3 months old, and the second one was 9 months old.
She says back then there were no services in place for people living with HIV.
Stigma is real, and discrimination is real, and it's still happening. So we need to address that within families and within communities, and that's what I see in a couple of families with HIV. They don't want to go near anything to do with HIV, so it's quite sad, but that's the reality.
Okay.
This stigma is even stronger for Papua New Guinea's sex workers, especially those from the trans community. According to the WHO, HIV cases in PNG are significantly higher among female sex workers, men who have sex with men, and transgender people. Social taboos and stigma mean many of these people are driven underground, too afraid to seek help and often silenced when they do.
When we also do sex work, it's always very hard. Sometimes they call us names, attack us. This is not a good time that we're going through. HIV is increasing in our country.
Trina, a transgender woman, is a sex worker here in Hohola. She's been working here for 20 years.
I started going into sex work just to survive.
She admits to having unprotected sex with clients despite the risks.
The next day I'm already rushing to the clinic to get PrEP. I tell them I had unprotected sex with a client and I don't know him or trust him.
Trina says health services can also be discriminatory.
Sometimes they're not really friendly. Those that are sensitive, they treat us well. Others who aren't just ignore us, walk and look at you and giggle off to the side and just keep walking.
I believe the government is beginning to understand now that we must take responsibility by committing funds from our country to support these public health programs.
PNG Health Minister says the government is trying to plug the gaps left by the withdrawal of foreign aid. He's also calling on the public to do its part.
The increasing number of HIV in the country is due to the fact that people are not doing enough public health awarenesses, and people not knowing their status. There's a lot of unprotected sex going around in the country.
But when it comes to stigma, the health minister says great progress has been made.
I believe many of our people now have come out of this stigma. People now can walk freely to HIV clinic and get their bloods tested. It's no longer, I don't see a stigma as an issue anymore in our country.
Tessie Soy is a social worker and one of PNG's most well-known advocates for people with HIV. She disagrees.
The stigma and discrimination has not gone off. It is still here.
But more than anything, she's worried the epidemic is once again getting beyond the control of health authorities.
We're battling. We haven't got there. At one stage, some years ago, about maybe 15 years ago, I thought we were going somewhere. But in the last 10 years, all the posters, the billboards, they're not there anymore. And the numbers are increasing as we see the cases that come into our hospital.
Everyone we spoke to for this story has battled this crisis for years. They've lost friends and seen too many young lives cut short, all while carrying the burden of an epidemic that has never fully eased. But despite that, they say there is still a path forward, and that HIV in Papua New Guinea can still be brought under control.
I believe so. It can be stopped. Let's keep whoever is positive, let's look after them, but through our education, our awareness, our compassion, we can stop HIV.